Story time. Today I wanted to share with you about the importance of sharing our life story in a counseling setting, both as a client and as a psychologist. I feel my life was altered because of the healing experience I had in counseling, so I want to pay it forward to you. When I first went for my first counseling session, I could hear my heart pounding with an anxiety and thinking to myself, how can I make this woman, American woman, understand the cultural impact of 3,000 years of history and how women have been treated, and my personal experience? How can I help her understand that? However, I was in for a pleasant surprise that when I did share about my history, her validation affirmed, like she understood, got it instantly, reminded me that our feelings and emotions, the essence of who we are universal. We may look different, we may speak different languages, but our essence are the same. Pain is universal. And that is the importance of being able to share our life experiences with a trusted person in a safe setting, free from any judgment. Counseling, because of its confidentiality, by the nature, has the high potential of healing. It's not the only possibility. The important thing is for us to feel safe and trust, especially when we have been abused, mistreated by trusted people, by people who were supposed to take care of us, nurture us, and make us feel loved and safe. Then when that didn't happen, why should we trust anyone? The fear is very real. Am I safe to share about what really happened to me? So because of that, it's really important to understand the process of counseling. And it's a very important distinction between visiting a medical doctor and a clinician. We are so used to the medical paradigm. You know, a patient goes to a medical doctor and talk about what's wrong, what's not working, what's hurting, and the doctor is in charge of the treatment. So the doctor instructs the patient, or like, do this lab, take this x-ray, take this medication according to this information, and the patient is to follow the instruction. The patient may not know anything about the medication, may not know what the chemistry of it is, but trust the expertise of the doctor, that if I take these medications, it's gonna help make me feel good. It's gonna release me from the symptoms, a relief. So usually it's a pain that motivates us to consult with someone, and usually what we are looking for is a relief. But I would like to share with you about the counseling process being very different from a medical paradigm in our next video. And with that, be patient with yourself. The journey of emotional healing requires gentleness and basically self love. I'll talk to you soon. Namaste.